Philippines is prone to typhoons due to its geographical position, which generally produce heavy rains and flooding. These situations can potentially increase the transmission of waterborne diseases, and the children are the ones who suffer the most. This morning, together with Doc Catherine Porciuncula and Doc Shida Nicbin, we will get to know the symptoms, causes, and how to prevent waterborne diseases here in Doctors on TV. Our guest this morning is a medical specialist for and has 20 years of service in San Lazaro Hospital. She is a diplomat and fellow of Philippine Academy of Family Physicians. She is a member of the Board Council of the Philippine Society for Microbiology of Infectious Diseases. Please welcome Dr. Nympha Putong.
So, Doc, infectious diseases ang ating specialty. So, ang topic kasi natin today is waterborne diseases. So, more on mga nakukuhang sakit.
So, ito yung mga sakit na nakukuha natin because of ingesting or bodily contact with contaminated water. Mixed with fecality materials. So, yung na-ingest natin, no, accidentally, yung may dumi, ebs, no? Or even the contaminated urine, usually sa mga animals, rats, that may be caused by leptospirosis. And based on historical data, pag tag-ulan talaga, we expect the increase of number of cases ng mga waterborne diseases.
What are the types of waterborne diseases?
So, there are two types. One is diarrheal form. Example natin yung amoebiasis. And the other one yung nakakatakot na cholera. No?
Cholera.
Yes. Upon exposure, let's say you are a person with cholera and then transmit sa akin yung sa fecality material, no? In just a matter of even hours or 24 hours, especially if the person is immunocompromised, let's say may cancer, may diabetes na poorly controlled, no? May HIV, or let's say yung streams
young
of
children,
age.
Doctora.
Yeah? Of course, the young, the very old and the very young. So ito yung mas prone towards complications and even death if without proper intervention or treatment has been given. Another example naman natin, especially doon sa mga younger, under 5, no, yung rotavirus. No? Unfortunately, 1/3 of yung mga severe form of diarrhea is caused by this vaccine-preventable rotavirus. Yes. And there is also what we call Shigella naman, or the dysentery form, wherein there is fever, there is severe abdominal pain, and there is also bloody diarrhea. So ito yung one form natin ng waterborne diseases. The other one is the non-diarrheal form. So dito papasok ang ating typhoid fever, ang ating hepatitis A, no? E. And the other one is, sabi nga natin, when expect natin pag tagbaha na, no? During flooding, we have the leptospirosis. Pero hindi lang talaga ito yung sa bahan, akala natin. Even the mud flood, yung pang nasuong ka sa putik. Yeah, that can also bring leptospirosis.
So, doon po sa lahat ng na-mention nyo, Doktora, what is the leading cause of death naman? So, are there any mortality?
Unfortunately nga natin, sa diarrheal form natin, among those under 5, no, diarrhea is the most common cause of death. Ang first is pneumonia. And around 90% of this diarrhea is infectious by nature. Yung na-mention nga natin earlier, no, both sa mga bacteria and virus, no, and also yung parasite na amoeba, no, and those under 2, in around 7 to 2% ng mortality or death are among these 2 years old and below. That is why ang Department of Health natin, in-strengthen talaga yung advocacy towards exclusive breastfeeding sa mga 6-month-old pababa. And then up to 2 years old, breastfeeding pa lang with complementary feeding. Because through breastfeeding, we can decrease the number of mortality related to diarrhea as well as pneumonia.
Because
and studies have already proven na napakaganda talaga kaya encourage natin these mothers to breastfeed their babies.
Prevent also contamination kasi through breastfeeding, diba, Doktora? Kasi
Correct.
exclusive.
Yeah,
So,
as a mother, you know better.
Yes.
Yeah. So our viewer also, you know that, so breastfeeding is actually good for the
It's still
kids.
best for
Yes.
babies.
Yes.
Best for babies.
And it's free, I guess.
Yes,
So
of
it's good.
course.
And you mentioned about diarrhea. How will, like a mother, like the kid having diarrhea, how will they know that this is caused by any waterborne diseases? So, or what can they do right away when that happens?
Yes, so among babies, no, 6 months pa ba, especially if it's exclusive breastfeeding, it's just not natural, no. Let's say during the time that the baby is being breastfed, na magkaroon din siya ng, let's say they call it loose stool, or somehow they associate it, but it's just normal, no. So it's not the frequency or the number of times that these babies defecate, but it has something to do with the consistency of this stool.
What are the symptoms of the diarrhea or non-diarrhea?
The usual presentation of diarrhea is this bowel movement of at least 3, no? At least 3 in a day, associated with nausea, vomiting, abdominal pain, and fever.
for less than 2, Doktora, you see them and having diarrhea, so you dapat by observation lang po. So, ano po yung dapat i-watch out ng ating mga mothers na viewers natin ngayon na
So sa atin, sabi nga
symptoms.
natin, anticipatory prevention is better than cure. If you see that this unusual number ng parang mas pumapanay yung pagdami, or the baby, yung pag-feeding niya is nalalesa na, no?
May loss of
poor
appetite.
sac, yeah, you call it poor sac, no? And then kind of weak na siya, hindi na masyadong nagagalaw or active ang baby, no? And you see that the water is hindi siya yung normal, no? And the best thing pa rin is yung if this is 1-year-old, no, better to consult na rin talaga the physician.
Right
But
away.
pag sa bahay
Pediatrician.
pa lang, yeah, you can have this Oresol that we call the oral rehydrating solution, because we want to prevent complication, which is dehydration.
Up next, Dr. Nympha Putong will share us some tips on how to prevent getting waterborne diseases. Doctors on TV will return after a short while.
Since we're living in a country like it's umuulan, diba? Like most of the time, I still don't know when is really rainy season or when it's summer. It's like parang
It's
it's like
crazy weather.
It's crazy
Oh,
weather. So
yes.
since we are in this type of weather country, so what is the prevention that we won't get this type of diseases?
So, what are these preventions that we can do? Number 1, we have to integrate way of life na natin that whenever we eat, no, before and after we eat, hand hygiene,
Hand washing.
maghugas ng
Opo,
kamay pa
oo.
rin. If you're going to eat, make sure that the food that you are serving, no, dapat within 2 hours na iyan ay niluto, you have to eat it right away. Para maiwasan natin tinatawag na rotten food, yung mga
Yeah.
panis na pagkain, ano.
Even washing the
Yes.
fruits and all that, the water that they're using supposed to be drinking water, right? Not
It should be
the
clean,
clean
water. Now, if you are not sure, boil the water for at least 2 minutes. No? So, by the time na rolling water na siya, yung kumukulo-kulo na, you count 2 minutes to make sure that these pathogens are killed.
Doctora, you mentioned about symptoms of diarrheal, but how about the non-diarrheal? What are the
For
symptoms?
example, in leptospirosis,
Yes.
no? I remember during the time that we
Yes.
were in our clerkship, no? We're fans of the triad. Eh. So for leptospirosis, we have this 3 triad. Number 1 is fever. You see anything that is infectious, no? We always look for fever. And the second is the presence of this conjunctival suffusion,
Yes.
wherein when you look at the eyes, para siyang may sore eyes, no? Na there's something in
Red,
the eyes.
red, yes.
Yes. And the third one is calf tenderness. Ang sakit-sakit ng binti. Yan. Or others talagang buong katawan ng masakit. And then when you'll go back to the history, they would say, nag-take ng pain reliever for muscle pains. And then you ask, is there a history of wading in the flood few days or a week ago?
Yeah.
And oftentimes the answer is yes. If not, ask mo naman, was the exposure doon naman sa mud, sa putikan, hindi man siya baha, putik naman ang nadaanan natin. Yes. So that's for leptospirosis. Now, what we do not want to happen is the severe form of leptospirosis, and we call it as the whale's disease, wherein aside from fever, there is already what we call jaundice, or yellowish discoloration of the skin of the eyes, and also the renal failure, wherein the person is no longer urinating, hindi na siya umiihi. Take note, if the person is no longer urinating for at least 12 hours, no, 12 oras at hindi na umiihi ang tao, no, that's alarming. You have to go to the hospital and see consult. Otherwise, it means that you already have a renal problem. Yeah. Even if you do the laboratory, you may even have a normal BUN and
pwedeng
creatinine
negative po.
because at the early renal injury, no, your creatinine and BUN may remain normal, no? But then the urine output is still the most sensitive measure para malaman natin sira na pala ang bato because of this.
Usually when it
leptospirosis.
happened, like how many days after it happened?
It depends. It depends on the immune system of the person, on the host itself, herself, himself, no? Kung mahina ang resistensya, no? And the number of pathogens that you have in your body.
So basta when we
So when
already-
symptoms
yeah.
set in and you don't feel comfortable, or if in doubt, go to the nearest healthcare facility
So not take
to
it
prevent
easily,
complications.
Yeah.
So you
habang
may
maaga
ask,
po.
so what are these complications? No? So the most common complication that we want to prevent, no, in common cases of diarrhea, no, dehydration pa rin. Okay? Dehydration. So sa amin, based on the studies, these are very simple examination that you need not any laboratory test na hindi ka kailanganin ng pera. Number one, you just look at the person, look at the breathing. Talagang deep, fast breathing. We call it yung hinahabol ng paghinga na parang sisiw na hirap. So that's when it gets a person must be dehydrated. And the other one is when you do the capillary refill test, no? So let's say ito yung sa finger natin, sa nails, no? And then you just press it. The normal should be less than 2 seconds. 1,001, 1,002, and then pag nilift mo siya, back to normal na yung skin color natin sa nail. Now, if it is more than 2 seconds and prolonged, no? So ibig sabihin, signs of dehydration. And the other one naman is yung skin turgor test na tinatawag natin. So pagka pinage mo yung skin, let's say between your 2 eyebrows, we call it the glabella. This is the most sensitive part, no? So pagka pinrest mo yan, no, 1,001, tapos bumalik siya, no, less than 2 seconds, no dehydration. Or dito sa anterior chest natin, below the clavicles, sternum natin, i-pinch mo rin siya, it goes back to less than 2 seconds, it's normal. But if it is prolonged, dehydration siya. So these are simple indicators para malaman natin if the patient is having dehydration. And yung third rin nga natin is, isa pa natin is yung urine output. If the patient is no longer urinating, hindi na umiihi sa loob ng 12 oras, no, it is alarming. It's a red alert. No? Hindi pwedeng sa bahay lang siya eh.
So,
You have to
Doktora,
bring-
do you also test for yung parang namumutla? Kasi sa mga nanay, yun ang una nilang inoobserbahan, parang namumutla yung anak ko, tapos di ba po, isa po rin yun sa sign.
Yeah, isa rin yun. Lalo na yung mga nagiging cold, clammy ang skin. We call it circulatory collapse. Nanlalamig yung mga paa at mga to, lalo na pinasabayan ng parang nagpapawis. No?
Yeah.
We call it parang in the shock, in the state of shock na. No? Yeah. So, early stage pala nakikita mo na dumadalas ang pagdumi. The best thing you do is rehydrate the person. So, bigyan na natin ng oral rehydrating solution. Now, if you are in a far-flung area, sabihin mo, you are in the most remote rural area, wherein the public health is not available, no? You can have this 1 liter of boiled water, and then mix it with 6 teaspoons of sugar and half teaspoon of salt. it's already a homemade aerosol and
Pwede
give
na
it,
siya.
no? And there is saying na pwede yung they call it,
Yung pong pinakuloan sa
sa
rice.
sa sinain.
Opo, sa
no?
sinain.
You can also give it, no? As a way pa to rehydrate the person.
So mga nanay, kailangan po obserbahan natin ang ating mga anak at look for signs of dehydration or yung nawawala na po sila ng tubig sa kanilang katawan. So,
Better.
rehydrate po nila.
What we want really is to prevent these people from getting
Usually,
dehydrated.
where does this
Yes.
diseases occur? Like which
Well,
areas?
the most, let's say when we had this in 2016, we have a series of packets of outbreak, no, that happened first around January, no, in Camarines Sur, Bicol, and then come May, meron din sa Quezon, and then sa Bukidnon, no, around September, Bacolod, mga September in Pampanga, there was outbreak of cholera also. And then mga October in Bacolod, there was an outbreak of cholera. So these are packets of cholera outbreak. And we have noted that during natural disasters, the most common of which is pagka nagkakaroon ng baha, no? So expect mo ng packets of cholera outbreak. No? Why? Because of
Everywhere po yun, Doktora.
yes, shortage of water, contaminated water. Yan ang common source niya.
Are waterborne diseases contagious? Hear the answer from Dr. Nympha Putong when Doctors on TV returns.
Doctor, a question from a viewer as
Yeah.
well. Yeah, is this waterborne diseases contagious? Like the
Very good
diarrhea?
question. In cholera, no, yung transmission from one person to another is faster, no, and more virulent ang ganon, no. That's why it's very important
Yes.
that you always practice hand hygiene, no. Wash your hands, especially if you are in contact with if you are a healthcare worker, you have to use the proper PPE. Since this is a contact-borne precaution, you have to wear gown and gloves if you are in front of a patient.
How about if what are like the home remedies? Like this happened, and there are group of people,
So,
of course,
again, as
families.
I said earlier, no, as soon as possible, rehydrate the patient. If there is no aerosol available,
Yes.
make one in your home. 1 liter of clean or boiled water plus half teaspoon of salt and 6 teaspoon of sugar. Mix them together and you let the patient drink it, no? Hanggang kaya pa. Because, no, especially among children, among infants, no, another common cause yung pag, let's say, nagkaroon ka ng diarrhea and the patient keeps on vomiting, mag-aspirate, magkaroon yung pneumonia. So these two most common leading cause of death, pneumonia and diarrhea, will be the cause of death for this infant.
As
for
a
this
complication of the
baby. As a
dehydration.
complication of the diarrhea.
It's just like the same day, like few days later.
No,
if they,
you don't wait for a few days
Yeah.
later. Usually we have this cut-off of 3 days, no? Among normal average individuals, no? If diarrhea persists for 3 days and with accompanying fever, you have to consult the
Yes.
physician. But again, if it is the young, the very young, and these are the vulnerable groups of people, no? We have to have this early aggressive management, no? When there's signs of diarrhea, you give the aerosol na, no? And you see, if the patient, no, if the baby stops sucking, no, kasi still the best method pa rin dyan is weapon natin is breastfeed the baby, no. Now, if the baby stops sucking, don't wait until the patient gets dehydrated. Kasi ang bilis ng dehydration yan very, very soon. Kasi alaki ng surface area yan compared doon sa volume. So again, in such cases, dalhin mo na sa pinakamalapit na health center.
Opo.
what are like yung prevention, like for us to prevent this?
Again, number one, no, except yung sabi nga natin is make sure na you're using clean water. Kasi this infectious disease comes from contaminated water, itong waterborne diseases na ito. Second, we have to keep our environment clean. Sabi nga natin, if you see more cases of leptospirosis nag-outbreak, it's a reflection that we have a very poor environmental sanitation. Marami mga baha-baha dyan, marami mga daga, ihi ng daga, na yun ang nagkukos noon ng leptospirosis mula sa ihi of this urine of these rats.
And I'm sure the outbreaks, Doktora, or yung mga incident is nakikita natin dun sa mga areas talaga, mga slums, and then sa mga hindi well-managed or
Yes, yung when the environmental sanity is very poor, no? And of course, number 3, yung hygiene natin. Hand hygiene, number 1, yung kakain natin. And make sure, kung dudumi, you have to have this talagang comfort room, palikuran as we call it, and you don't just defecate
hindi kahit
anywhere.
saan.
Because this stool, it contains these pathogens na handoon ng mikrobyo. Now, unfortunately, there are people, as we call it, are carriers. They are asymptomatic. They don't have the signs and symptoms, but they carry the disease. So sa akin, I would also advise na if you can, sa mga mothers natin, for those who are working, if we can cook at home, yung mga homemade, mga sariling lutong bahay, malinis na, masarap pa, sigurado, garanti
alam
sa
mo na
mura
well-prepared.
Pa, Instead of hindi naman natin ina-underestimate because we want to make sure, lalo na ngayon tag-ulan, ang bilis kasi ng growth ng mga pathogens, ng mga microbial na ito. Sometimes kasi this is from the street foods, we are not sure.
Especially hepatitis.
Yeah, because they are those who can carry, they are carriers. They are asymptomatic, but they carry the infection. Yeah? And they can transmit it because it's fecal-oral. So mula sa dumi, madumi kayo, dahil pupunta ka dyan, wala namang sapat na sufficient water to clean the utensils, and those things that you're going to eat. So again, probably if you want to lessen the possibility of getting infected from these waterborne diseases, might bring your own food or make sure to buy from those clean with licensed sanitation.
There's also, Doctor, a question from our viewer asking that she had an LBM for 3 days.
Yes.
Pero after a while, she become better, then it goes back again. Is that something alarming or
yes,
to be worried?
Kasi there are different types nga of diarrhea. And for example, this amoebiasis, may relapse na tinatawag If you give the medication for 7 days, tendency is for this to have relapse. Babalik siya. And other members of the family may get infected as well. So you have to take the medicine, this is metronidazole, for at least 10 days to 14 days. Again, make sure that the water that you are using is not contaminated. Has to be boiled, clean when you drink it, when you use it, when washing the dishes, when cooking. Okay?
Even washing the dishes supposed to be a clean water.
Also, because even if you're drinking the clean water and you're
Yeah.
using the contaminated water for washing, that will also be the source of infection. When you're cleaning your fruits or your vegetables, and if it's contaminated, that will be another source of transmission of infection.
And Doctora, we have experience also with patients taking anti-diarrheal medication.
Yes,
So,
yes.
ang dami rin po kasi sa market nagiging available pa over the counter.
Unfortunately, antibiotic is not anti-diarrheal. Kasi for cases of amoebiasis, we don't give the antibiotic because it's a parasite. In the case of rotavirus,
Yes,
this
you
is
don't
a
also.
virus,
Yeah.
we don't give antibiotic because this is a virus. Management is supported. Again, for all these cases of diarrhea, we give the oral rehydrating solution. We want to rehydrate the patient as soon as possible, in order to prevent further complications.
What are the rehydration water that we can get from the store?
They are saying this sports drink water. They advise to give it. It's a no-no
Oh, okay.
because it
So no
contains
to
a
the
lot of
sport
sugar
water.
that will bring out osmotic diuresis. So instead of rehydrating the patient, it's diuretic. So mas maraming ihi, tubig ang lalabas sa katawan. Again, we do not advise giving of these sports drinks. Okay? What we can give again and again is the oral rehydrating solution.
It has to be the one that is prescribed po or yung nireseta po ng inyong doktor.
Or sabihin natin yung mga coconut juice.
Yeah.
But it has to be fresh.
So in terms naman po, Doktora, sa mga leptospirosis cases, balik po tayo dahil nga po very rampant during rainy seasons. Ano pa po yung mga prevention na i-advise sa review?
Yes.
Siyempre, susulong sila sa baha,
Correct.
pero
Very good.
may
Yes.
sugat or walang
Yeah.
sugat?
Kung may sugatin lang naman, pupunta ka sa baha, are you willing to to take the risk na magkaroon ka ng leptospirosis with your bare foot na, no? So, you may wear boots. At kung hindi naman ganun ka talaga ka-importante ang pupuntahan mo, might as well stay sa bahay na lang. No? You may just call, whatever mode of communication you can do. You can defer your lakad, no? Kasi nga, if it is a flooded area, no? I mean, don't take the risk kung ikaw may
Kung
sugat.
sumulong sa
Or
baha.
kung hindi maiiwasan, we have this prophylaxis, you can take the doxycycline. Yes. So, one time ka na na-expose doon, you can take the doxycycline, that's 100 mg per tablet, no? 2 tablets, single dose. And let's say, naglalakad ka sa baha, suddenly, you ingested this contaminated water, no? At alam mo, marami dyan nagtatakbuhan, nagkakamarathon ng mga daga, no? Expect mo yung ihi ng daga can contaminate the water, no? So, during this time naman, you take it 2 tablets, no? For 3 to 5 days.
3 to
Now,
5 days.
nandun ka sa lugar kung saan naman flooded talaga at madumi ang kapaligiran, alam mo na nagkaroon na ng leptospirosis, or you are a rescuer, trabaho mo talaga mag-rescue. You have no choice, this is part of your job.
Yes.
So you have to take it naman, no, once a week, as long as you are exposed in that flooded area.
So mga kasambahay, we learned a lot from the waterborne diseases, but there was a lot of different type of disease pala. Thank you so much, Doctora, for coming here and visiting us and letting us know about this different type of waterborne. Also,
Yes, I'm sure maraming natutunan ang ating mga viewers. Thank you very much, Doktora, for gracing our program.
thank you, Doctora.
Thank you so much,
Salamat.
Doktora.
Thank
Salamat
you.
po.
Yes, salamat.